My beautiful patient came in with the chief complaint of perioral aging and fine lines. Her main concerns are her nasolabial fold and her marionette line, so we're going to use a little Evolysse form to soften the appearance of her marionette line and nasolabial fold. So I am here just marking out the folds. I like to do this in advance because when you insert that cannula in, it projects up that tissue and you can't really see that fold anymore. So I always perform these markings when they're in the upright position so that gravity is helping play a role and really we can see those folds and those shadows. So I always start out with a little lidocaine with epi and bicarb just to numb the little port site. I'm going to use a 23 gauge needle to create my entry. And my go-to cannula is a 25 by 1.5 inch cannula. That is the workhorse of my day. I'm obsessed with this cannula and can do so much with it. So just inserting it into the entry port and working my way up towards that nasal ala. So I always tell the patient as I'm creeping up that they're going to feel a little pinch as I get up closer, and that's totally normal. Now remember that facial artery sits deep near the oral commissure, and as we creep up towards that nasal ala, it does live more superficially. So for me, while I'm using cannula, I am still mindful of that facial artery or angular artery sitting near the plane of injection that I'm in, but you will find that I never push any stationary boluses whatsoever. I am always continuously moving that cannula as I am retrograde injecting. So I never push product as I'm moving forward. I'm just creeping my way. I always say I'm knocking on the door of those fibers and having them let me in. So I'm just creeping my way up into that nasal ala ever so slightly. I'm not putting any resistance or any extreme pressure. I'm just kind of tapping and they'll let me in. I'm also not pushing any product as I move forward. Once I get into that pocket, I just lay nice retrograde threads, always moving my cannula as I am pushing product. So then I clean off the area to see, and look, it's already softening up so nicely. I really like using Evolysse form in this area. I find that it projects out that soft tissue quite nicely. It's really soft, but still has enough robustness and G prime to give you a little bit of projection without too much mass. So now I am inserting my 23 gauge needle and using the same cannula. Now here what's important is that you really spend a little bit of time subsizing this area because there's so many little fibers in this area that you really want to make sure you lay nice paths for your filler to just lay nicely. So I'm just working my way up. It can be, you could see right there, she felt a little sensitivity. For the most part, this is a fairly comfortable treatment, but she will feel some little moments of sensitivity, which is totally normal. I always say make sure that you have your patient in a position where you can have this nice, continuous, seamless plane and your cannula is not bending. So just working my way into those folds, just tapping on the door, waiting for it to let me in, and then laying a nice retrograde thread of filler. So again, just working my way up and retrograde thread. And then I'll work my way up and retrograde thread. So just tapping on the door, nothing forcibly. Remember that mental foramen is in this area that has the mental artery, vein, and nerve coming out of that foramen. So you want to be really mindful. Again, I'm never placing any stationary boluses, always moving retrograde threads. So just placing small threads, taking my time. I never place one thick wad of filler. I always kind of paint the area. I'll place some threads, go back, place some threads, go back. And I always do this movement right here, boom, where I kind of blend it into the fibers of the tissue. This really changes how it lays, and look at how beautiful that is turning out. Again, I always tell patients as injectors, we are merely smoke and mirrors. I am not doing anything to solve or remove the jowl or remove the laxity in this area. I am simply softening shadows, and the shadows are what are aging us. So if I can soften the shadow, then it doesn't look as textured in this area. So I always tell them my goal is just to project it up softly, You will still have some remnants of that marionette line and chin shadow region, but our goal is just to make it look rejuvenated, refreshed, and softer versus that stark fold that she had previously. So I felt that I needed a little bit more product, so I just work my way in and lay some product right where those markings are. But you could see when that cannula is in place, it projects up that fold, so you're not really sure. So I'm always marking that area. And then I always have a little bit of alcohol on my gauze to make sure that I'm constantly cleaning the area. But look how much softer that looks. You could see on the left in that before and after photo how beautifully that product is just integrating into the tissue. She still has obviously some aging in that area, but it just looks so much softer. And now I'm going to work on the left side of her face, but I love this treatment. This is a big part of my day, nasolabial fold and marionette line, really the marionette line and chin shadow because of the age demographic that I reach in my area, but I love this treatment so much. And now look at her reaction. This is the best part.
Oh my gosh. That is so wild.
Doesn't that look good?
You were right. That is amazing.